My name is Diane Dooley. I'm a pediatrician. I work at Contra Costa County Health Services, which is a large safety net hospital and clinics in the East Bay.
My name is Peggy Walsh, and I'm a professor in the Department of Preventive and Restorative Dental Sciences at the UCSF School of Dentistry.
The pediatric department has been working for about a year trying to implement a project to apply fluoride varnish to the teeth of children aged 1 to 5 to prevent cavities, and we found we were not able to do that project without more help. UCSF Center to Address Oral Health Disparities in Children worked with us on a research project during which we were able to address a lot of barriers to the application of fluoride varnish in primary care clinics.
I've always been very concerned that, we have evidence that takes about 17 years to get translated into practice. That's kind of like from the bench to
the San Francisco-based Collaborative Research Network was able to fund us to study the fantastic process of planning and implementing the fluoride varnish in our system.
Toward the end of that study, we hadn't really finished our data collection, but our funding ran out. And through the San Francisco Bay CRN, we were able to submit an application to get some bridge money that allowed us to, it wasn't a large amount of money, but it was an adequate amount of money to complete the data collection that was necessary to finalize our project.
We found that by having UCSF participate, there were a lot of times in which the barriers to the project kind of dissolved. Is somewhat because they brought what I've said is a gravitas to the process, where people seemed to believe that it was a necessary process because the academic people were involved and were sometimes more willing to make changes in our system than we found on other projects.